Tremendously. It has provided me with the inspiration to continue to grow as a professional, as a clinician, as an educator, and as a researcher. How has it impacted your career beyond that point?
I have so much more appreciation for soft tissue dysfunction now because I'm feeling things that I just can't feel with my hands. I'm feeling so many more of the subtle lesions, and now I feel like by addressing those lesions, my treatment interventions are so much more thorough and effective, much more effective than what I had been doing previously without the instruments.
I have been a physical therapist for over 30 years, and I would consider myself to be a manual therapist for all of those 30 years. And I'm also a pretty avid consumer of continuing education, and the Graston technique has really helped define my clinical practice. I use it with almost every single patient, either as a main intervention or at least part of their plan of care, and the outcomes that I have realized have been phenomenal.
I think it's given a better opportunity for my students to learn manual therapy techniques, because that's something big with athletic training, and I see an advantage doing that and also doing exercise, so combination treatments, because I'm really big on the healing process of non-contractile and contractile tissue, and this gives a way to structure that's not going to heal as quickly as the other structures are. So you need to give it a little edge, especially in chronic injury.
It's helped a lot, especially with our athletes, because these days a lot of athletes want more hands-on, and I've been doing it with a lot of chronic issues. I've had a couple basically acute hamstrings that I've done it on, and I've seen more success with the Graston than I do any just regular manual treatment.
I feel like I really have a resource to offer people, being Graston technique certified, being able to offer a service that to be able to help people recover that was never available to me before.
Yeah, I mean, I probably use the instruments on at least 80% of my patient population, and I have had remarkable results with several of them, and everybody's getting better.
Oh, it's been amazing. I mean, I use it every day in my practice. I don't even advertise. All my patients come in a referral, word of mouth, either from other clinicians, other physicians, or just from patients who have gotten great results with Graston technique. It's probably my best source for referrals.
Quite a bit, and the treatment that it helps me with my athletes is, off the chain, in the sense that I have, especially with knees with me, because I work with men's basketball, and a lot of the tendonitis, the adhesions in the knee, and I use the Graston tools a lot during the year, to the point of my athletes asking for it. They go, Keith, can you come in and can we do a Graston technique? And it's, every 2 days, a lot of them want to come in and get it done.
After taking the M1 and being exposed to the training, I definitely look at the body a completely different way after being introduced to the myofascial meridians, and it's just taught me a whole different way of looking at the body. It's not just going and taking care of the painful hamstring, but it's about going and looking up, below and above the injury site to actually find out that the weakest link is actually coming from somewhere else than where the pain's coming from. So it's taught me to kind of take a whole over body approach, and when I teach that to the students, I find myself making sure that I incorporate that whole body approach and not just pigeonholing and looking at where their pain or symptoms are at.
Thank you.